So, one of the biggest discoveries in the last 5 or so years has been this idea that there are multiple phenotypes of depression and depressive disorders. There has been a long-standing assumption that depression was simply a serotonin issue. And I think that narrative probably has been dominated by the pharmaceutical industry in order to get anyone who meets criteria for depression on a SSRI or SNRI. And the data that we have suggests that a lot of people don't get better on those medications. And in some cases, people get worse. And it's not to say that these aren't life changing, life saving medications. It's just that everyone with depression tended to get lumped into that single box or that single category as we're talking about. So when we think about other biological phenotypes of depression, the one that's popped the most is the inflammatory phenotype. This is the person that has just baseline higher inflammatory markers. Their immune system has become dysregulated, and they are dealing with some of their systems being off. And the area that I've taken the most interest in is inflammation that we know often starts at the level of the gut and can travel throughout the periphery, cross the blood brain barrier, and lead to neuroinflammation. And it's pretty safe to say that a lot of folks who have depression have higher levels of inflammation. It's harder to say that the inflammation is driving the depression. It can be a bidirectional process. But coming back to trauma, if someone has a lot of early life trauma, they have a lot of early life immune activation, and they are sort of self medicating with food, the likelihood of that leading into midlife or later life depression is high. And it doesn't necessarily mean that it's a serotonin problem. It could be, but there could be a lot of other factors as well. So that's the challenge in thinking about depression, is nuancing it, discerning between the different types, and really running some experiments with different interventions. So for example, if someone didn't get better on a SSRI, that points to the possibility that they might be more responsive to an anti-inflammatory dietary approach. So there's a lot of other mechanisms there. I'll move on to anxiety. I think one of the bigger findings with anxiety has to do with gut bacteria. There's been efforts to identify particular strains. Anxiety is responsive to nutrition intervention, but the data suggests that, the depression story is a little bit more clear because we have more longitudinal data, prospective studies that suggest, people that change the way they're eating can leave the depression category over time, and people that eat a lot of ultra processed foods low in fiber, low in nutrients tend to develop incident depression a bit more. So yes, anxiety and depression do cluster and co-occur and often get lumped together. But I think there's a lot of promise for anxiety. But again, anxiety is a broad term. We have generalized anxiety, and then we have more specific anxiety. So a lot of people need multi-layered support, not just nutrition interventions, but psychological interventions and social support, and being able to connect the dots between their biology, their thinking patterns, and their social context. And ADHD is super fascinating because it often develops earlier in life. And there's been great interest in the idea that some of the food additives in the food supply can be contributors. There's a lot of attention with ultra processed foods and food dyes, colors, etc. It's not super convincing in terms of the literature, but there are quite a few parents and moms that have reported when they are able to change their child's eating pattern, they notice significant improvements in their symptoms. So that's a part of evidence-based medicine that we can't ignore. But I think the overarching summary of all of them is that when people eat a lot of food that's low in nutrients and high in inflammatory compounds, low in fiber, it tends to be disruptive of the gut-brain axis. And when people can move toward um, colorful produce, high in polyphenols, a wide range of fibers, good quality protein, that mental health does tend to improve. We both know that those types of changes are challenging, particularly for the youth. So we have to be realistic. But I would argue that some of the major challenges with these very delicious and palatable foods, particularly ones that we feed to children, is that it sets up an expectancy for food to taste a certain way. In addiction literature, we call this reward expectancy. Someone is expecting a specific dopamine response from food, and if it doesn't give that neurochemical reward, it tends to become aversive, right? So, this is really the link between food and neuroscience that people need to think more about is how food can be rewarding, how the brain learns to assign value to food based on the dopamine